Happy morning, dear students. I'm welcoming you all to this online learning. Previous week, we started Unit 3, 7th chapter, Body Fluids and Circulation, and we have completed body fluids. Today, we will start with blood vessels. If you see the structure of blood vessel, the vessels that carrying the blood are of three types. They are the arteries, veins, and capillaries. The blood vessels in humans are composed of three layers: tunica intima, tunica media, and tunica externa. Tunica intima, that means the inner layer, and tunica media, it is the middle layer, and tunica externa is the external layer, right, which also contains protein and elastin. First, we see the arteries. The blood vessels that carry blood away from the heart are called as arteries. The walls of the arteries are thick, valves are absent, and have a narrow lumen. Lumen is nothing but space. All arteries carries oxygenated blood except pulmonary artery, which carries deoxygenated blood from the right ventricle to the lungs. The largest artery is the aorta, and this aorta branches into small arteries, and it also branches into arterioles, and finally it ends in capillaries. What are capillaries? Capillaries are a small, fine network of a tube which is present inside the tissues. The capillaries are thin-walled, and it is made up of single layer of squamous epithelium. The walls of these capillaries are guarded by semilunar valves. Next is the veins. The veins have thinner walls and have a larger lumen, hence they can easily be stretched. The veins carry deoxygenated blood except pulmonary vein. The unidirectional flow of blood in veins is due to the presence of semilunar valves that prevents backward flow of blood. Blood samples are usually taken from the veins rather than arteries because of low pressure in the veins. So, if you ask to write the difference between arteries and veins, you have to write it. It may be asked in 2-mark question. What are anastomosis? Anastomosis is nothing but the connection of one blood vessel with another blood vessel. They provide an alternative route of blood flow if the original blood vessel is blocked. For example, if the arteries in the joints contain numerous anastomoses, this allows blood to flow freely even if one of the arteries closes during bending of the joints. So anastomosis is nothing but is a connection of blood vessel with another blood vessel. That means artery with another artery. There is also another blood vessel called coronary blood vessel. What is that coronary blood vessels? The blood vessels that supply blood to the cardiac muscle with all nutrients and removes the waste or the coronary arteries and veins. So heart is also made up of a muscle, right? Cardiac muscle. So these muscles have to be supplied with the blood vessels. So the blood vessels that supply nutrients to the heart muscles is called as coronary blood vessels. Corona, that means crown. Next, we move on to the circulatory pathways. There are two types of circulatory systems. One is open, another one is the closed circulatory system. Open circulatory system means the blood vessels are absent, so the blood is filled in the body fluid. Okay, this type of circulation is seen in arthropods and most of the mollusks. In closed circulatory system, the blood is pumped by the heart and flows through the blood vessels. This is seen in annelids, vertebrates, and cephalopods. Amphibians have two auricles and one ventricle and no interventricular septum, whereas reptiles except crocodile have two auricles and one ventricle. An incomplete interventricular septum is present. Thus, mixing of oxygenated and deoxygenated blood takes place in the ventricle. This type of circulation is called as incomplete double circulation. Here, double circulation takes place, but the interventricular septum is incomplete, So it is called as incomplete double circulation. The crocodiles, birds, and mammals have two auricles or atrial chambers and two ventricles. The auricles and ventricles are separated by interauricular septum and interventricular septum. Hence, there is a complete separation of oxygenated blood from the deoxygenated blood. Pulmonary and systemic circuits are present. This type of circulation is called as complete double circulation. What is meant by complete double circulation? The complete double circulation means the auricles are separated by interauricular septums and ventricles are separated by interventricular septums, so that there is a complete separation of oxygenated blood and deoxygenated blood. Right? So next, a circulatory system is present in human. The structure of heart was described by Raymond D. Vance in 1706. The heart is made up of a special type of muscle called cardiac muscle. It is situated in the thoracic cavity. It weighs about 300 grams in an adult. The size of a heart is roughly equal to our closed fist. கையை அப்படி மூடி பார்த்தோன்னா அந்த size. Heart is divided into 4 chambers. The upper 2 chambers are called as auricles and the 2 larger chambers are called as ventricles. The heart wall is made up of 3 layers. The outer epicardium, middle myocardium and inner endocardium. The space present between the membranes is called as pericardial space and it is filled with a fluid called pericardial fluid. The 2 auricles are separated by interauricular septum and the 2 ventricles are separated by interventricular septum. The separation of chambers avoid mixing of oxygenated and deoxygenated blood. The auricle communicates with the ventricle through opening called auriculoventricular aperture, which is guarded by the valve called auriculoventricular valve. The opening between the right atrium and the right ventricle is guarded by a tricuspid valve. So it has 3 flaps or cups, whereas a bicuspid valve has 2 flaps or 2 cups. It is also called as mitral valve, which guards the opening between left atrium and the left ventricle. The valves of the heart allows the blood to flow only in one direction, that is from atria to the ventricle and from the ventricle to the pulmonary artery or the aorta. These valves prevent backward flow of blood. This is the main function of the valves. It prevents the backward flow of the blood. The opening of the right and the left ventricles into the pulmonary artery and the aorta is guarded by aortic and pulmonary valves or called semilunar valves. These semilunar valves are present at the base of the pulmonary artery and the aorta. Each semilunar valve is made up of 3 half-moon shaped cups. And then, if you see the origin and conduction of heartbeat, the heart in human is myogenic. What is meant by myogenic? Myogenic means cardiomyocytes. So cardiomyocytes means the cells present in the heart muscles can produce a spontaneous rhythmic depolarization that initiates the contraction. The sequence of electrical conduction. Okay, the cardiac cells with the fastest rhythm are called as pacemaker cells. The cardiac cells with fastest rhythm are called as pacemaker cells since they determine the contraction rate of the entire heart. These cells are located in the right SA node, that is sino-auricular node. It is also called as pacemaker. On the left side of the right atrium is a node called auriculoventricular node, AV node. 2 special cardiac muscle fibers originate from the auriculoventricular node and are called as bundle of His, which runs down into the interventricular septum and the fibers separated into the ventricles. These fibers are called as Purkinje's fiber. So for origin and conduction of heartbeat, 4 important things are there. One is the SA node, AV node, bundle of his and Purkinje's fiber. Pacemaker cells produce excitation through depolarization of the cell membrane. Heartbeat. Rhythmic contraction and expansion of heart is called as heartbeat. The contraction of heart is called as systole, whereas the relaxation of the heart is called as diastole. Normally, the heart beats 70 to 72 times per minute. During each cardiac cycle, two sounds are produced that can be heard through stethoscope. You know that doctors uses the stethoscope to find out the heart sound. The first heart sound, dub sound, no? So the first sound is the lub sound, is associated with the closure of tricuspid and the bicuspid valves. Whereas the second sound, dub sound, is associated with the closure of semilunar valves. Closure of these valves, the sounds are produced. Okay, these sounds are of clinical diagnostic significance. An increased heart rate is called as tachycardia. What is meant by tachycardia? If the heart rate is increased, it is called as tachycardia. Where the heartbeat has decreased, it is called as bradycardia. What is tachycardia and bradycardia is an important term. Next, we move on to cardiac cycle. The events that occur at the beginning of heartbeat and last until the beginning of the next beat is called as cardiac cycle. A sequence of event occurs at the beginning of one heartbeat and last until the beginning of the next heartbeat is called as cardiac cycle. It lasts for 0.8 seconds. So there are serious events. The first is the ventricular diastole. Diastole means relaxation. The pressure in the auricle increases than the ventricular pressure. The auriculoventricular valves are open. That means the tricuspid and bicuspid valves are open while the semilunar valves are closed. Blood flows from the auricle to the ventricles passively, that means slowly. Second one is the atrial systole. The atria contracts while the ventricles are still relaxed. The contraction of the auricles pushes maximum volume of blood to the ventricle until they reach the end diastolic volume. Okay, this is called as atrial systole. Third phase is the ventricular systole. During this ventricular systole, the ventricular contraction forces the auriculoventricular valves to close and increases the pressure inside the ventricle. The blood is then pumped from the ventricle into the aorta without change in the size of the muscle fiber and the ventricular chamber volume. Increased ventricular pressure forces the semilunar valve to open and the blood is ejected out of the ventricle without backflow of blood. This point is the end of systolic volume. And the last phase is the ventricular diastole, where the ventricles begins to relax. Pressure in the arteries exceeds ventricular pressure, resulting in the closure of semilunar valves. The heart return to the first phase of the cardiac cycle. So it is a very important 5-mark question. Right? So what are the different phases of this cardiac cycle? First one is the ventricular diastole. Second is the atrial systole. Next is the ventricular systole. And next is the ventricular diastole. Right? Next we move on to cardiac output. What is meant by cardiac output? The amount of blood pumped out by each ventricle per minute is called as cardiac output. That means the amount of blood that pumped out by each ventricle per minute. It is a product of heart rate and the stroke volume. So what is meant by heart rate? Heart rate is nothing but the pulse. It is the number of beats per minute. So pulse pressure is equal to the systolic pressure minus the diastolic pressure. What is the stroke volume? Stroke volume is the volume of blood pumped out by one ventricle with each beat. So this stroke volume depends on the ventricular contraction. So the cardiac output is the product of heart rate and the stroke volume. Right? So during vigorous exercise, the stroke volume may double as a result of venous return. Heart pumping action normally maintains a balance between cardiac output and the venous return. Next is the blood pressure. What is meant by blood pressure? Blood pressure is the pressure exerted on the surface of the blood vessels by the blood. This pressure circulates the blood through the arteries, veins, and capillaries. There are two types of blood pressure, systolic pressure and the diastolic pressure. Systolic pressure means it is the pressure in the arteries as the chambers of the heart contracts. Systole means contraction, right? So it is the pressure in the arteries as the chambers of the heart contracts. Diastolic pressure is the pressure in the arteries when the heart chambers relaxes. So the blood pressure is measured by using an instrument called sphygmomanometer. We can call it as a BP apparatus. The blood pressure can be expressed as diastolic pressure and the systolic pressure. That means the normal blood pressure in man is about 120 bar 80 mmHg. Here the 120 is the systolic pressure and 80 is the diastolic pressure. And next we move on to electrocardiogram. That means ECG. Next is ECG. ECG means electrocardiogram. An electrocardiogram records the electrical activity of the heart over a period of time using electrodes placed on the skin, arms, legs, and chest. It records the changes in the electrical potential across the heart during one cardiac cycle. It spreads a wave of contraction in the heart. The waves of ECG are due to depolarization and not due to contraction of the heart. A normal ECG shows three waves designated as P wave, QRS complex, and a T wave. So what is ECG? It records the electrical activity of the heart using the electrodes placed on the skin. Okay, there are three types of waves: P wave, QRS complex, and T wave. P wave. It is a small upward wave and indicates the depolarization of the atria. This is the time taken for the excitation to spread through the atria from the SA node. SA node or electrical impulses create ஆகும் இல்லையா, அது spread ஆகிற time. Contraction of both atria lasts for about 0.8 to 1 seconds. Next one is there is a small interval, that is the PQ interval. It is the onset of P wave to the onset of QRS complex. So P wave end ஆகுது, after the QRS start ஆகுது. This is from the start of depolarization of the atria to the beginning of ventricular depolarization. It is the time taken for the impulse to travel from the atria to the ventricles. It lasts for about 0.12 to 0.21 seconds. Next is the QRS complex. No separate wave for atrial depolarization in the ECG is visible. This atrial depolarization occurs simultaneously with the ventricular depolarization. The normal QRS complex lasts for about 0.06 to 0.09 seconds. QRS complex is shorter than the P wave because depolarization spreads through the Purkinje's fiber. Prolonged QRS wave indicates delayed conduction through the ventricle, often caused due to ventricular hypertrophy or due to block in the branches of the bundle of His. So QRS complex is occurring due to the electric potential travels from the SA node to the AV node and then to the Purkinje's fiber. Another one is a small interval that is called the ST segment. It lies between the QRS complex and the T wave. It is the time during which all regions of the ventricles are completely depolarized. The ST segments last for about 0.09 seconds. Next is the T wave. It represents the ventricular depolarization. The duration of T wave is longer than the QRS complex because repolarization takes place simultaneously throughout the ventricular depolarization. Okay, so P wave is due to atrial depolarization, QRS complex is the ventricular depolarization, and T wave means it is a ventricular depolarization. Then it starts the repolarization. This ECG is also a very important 5-mark question. You have to draw the diagram also, right? And next one is double circulation. Circulation of the blood was first described by William Harvey in the year 1628. There are two types of blood circulation. One is the single circulation, another one is the double circulation. The blood circulates twice through the heart, first on the right side and then on the left side to complete one cardiac cycle. The complete double circulation is more prominent in mammals because of complete partition of all the chambers in the heart. There are two types of circulation. One is the systemic, another one is the pulmonary circulation. In systemic circulation, the oxygenated blood entering the aorta from the left ventricle is carried by a network of arteries, arterioles and capillaries to the tissues. The deoxygenated blood from the tissues are collected by the venules, veins and vena cava and emptied into the right atrium. In pulmonary circulation, here pulmonary means lungs, right? The blood from the heart is taken to the lungs by the pulmonary artery, and the oxygenated blood from the lungs is emptied into the left auricle by the pulmonary veins. So, double circulation means it includes both systemic as well as the pulmonary circulation. So, completely separated circuits have a more advantage. In lungs, the capillaries must be very thin to allow gas exchange, but if the blood flows through these thin capillaries under high pressure, the fluid can leak or ruptures the capillary vessel and accumulate in the tissues. This increases the diffusion distance and reduces the efficiency of gas exchange. In contrast, high pressure is required to force the blood through the long systemic circuits. Hence, the arteries close to the heart have increased pressure than the arteries away from the heart. Next, how this cardiac activity is regulated. The type of heart in human is a myogenic heart because the heartbeat originates from the muscles of the heart. Myogenic, myonale, muscles. The nervous and the endocrine systems work together with the paracrine signals, that means the metabolic activities, to influence the diameter of the arterioles and alter the blood flow. The neuronal control is achieved through the autonomic nervous system, that means the sympathetic and the parasympathetic. The sympathetic neurons release norepinephrine and adrenal medulla releases epinephrine. The two hormones bind to beta-androgenic receptors and increase the heart rate. The parasympathetic neuron secretes acetylcholine that binds to receptors and decreases the heartbeat. Vasopressin and angiotensin II involved in the regulation of kidney results in vasoconstriction, while natriuretic peptide promotes vasodilation. Vagus nerve is a parasympathetic nerve that supplies the atrium, especially the SA and the AV nodes. So totally this cardiac activity are controlled by the nervous system. Okay, and endocrine system also plays a very important role in secreting the enzymes. If you see the disorders of circulatory system, it includes hypertension, coronary heart disease, stroke, angina pectoris, and myocardial infarction. Hypertension is nothing but high BP. The normal blood pressure of man is 120/80. If this diastolic pressure exceeds 90 mmHg and the systolic pressure exceeds 150 mmHg persistently, this condition is called as hypertension. Uncontrolled hypertension may damage the heart, brain, and kidneys. Coronary heart disease occurs when the arteries are lined by atheroma. Atheroma means is nothing but formation of plaque inside the blood vessels. So plaque grow within the artery and tends to form blood clots, forming coronary thrombus. Thrombus is nothing but it's a blood clot. So thrombus in the coronary artery results in heart attack. Next one is the stroke. Stroke is a condition when the blood vessels in the brain burst. That means it is called as brain hemorrhage, where there is a block in the artery that supplies the brain. Part of the brain tissue that is supplied by this damaged artery dies due to lack of oxygen. It will cause stroke. Next is angina pectoris. Angina is nothing but the pain. Okay, pain in the heart muscles. So, atheroma may partially block the coronary artery. Atheroma means the plaque formation blocks the coronary artery and reduces the blood supply to the heart. So, if the blood supply to the heart is less, it leads to difficulty in breathing or choking. So, this leads to angina. Usually, it lasts for short duration of time. Next one is myocardial infarction. It is called heart failure. When the blood supply to the heart muscles is remarkably reduced, it leads to death of heart fibers. This condition is called as heart attack. Blood supply heartuku போகக்கூடியது reduce ஆச்சுன்னா heart muscles death ஆயிடும். It leads to heart attack. The blood clot blocks the blood vessels, blood supply to the heart and weakens the muscle fibers. It is also called ischemic heart disease due to lack of oxygen supply to the heart muscles. Next is the rheumatoid heart disease. Rheumatic fever is an autoimmune disease which occurs 2 to 4 weeks after the throat infection, usually by the streptococcal infection. The antibodies developed to combat the infection cause damage to the heart. Effects include fibrous nodules on the mitral valve, fibrosis of the connective tissue, and accumulation of fluid on the pericardial cavity. So, this rheumatoid heart disease is an important 2-mark question. And next is the diagnosis and treatment. How we can diagnose these disorders? First one is the angiogram. Angiogram is nothing but it's a procedure that uses the X-ray to see how blood flows through the coronary arteries of the heart, and it can be used to detect the abnormality in the blood vessels throughout the body. Angiogram மூலமா எப்படி blood vessels இருக்கு அப்படின்னு பார்த்துக்கிறது. Next one is the angioplasty. Angioplasty is the stretching of an artery that is narrowed due to atherosclerosis. Atherosclerosis is nothing but formation of plaque inside the blood vessel. The risk involved in this process is a minimum. During the angioplasty, a small, long balloon catheter is threaded through the blocked artery. A deflated balloon is attached to the catheter and the balloon is inflated to widen the arterial wall. And then the tube and the balloon are removed. A small metal scaffold called stent is left in the place. What is meant by stent? What is meant by stent? Stent is a small metal tube which helps to keep the blood vessel open and allow free flow of blood. Angioplasty. Plasty na ஒரு சின்ன operation. Okay, next one is bypass surgery. When the arteries that bring blood to the heart muscles are blocked by accumulation of fat, cholesterol and other substances, the person is advised to go for bypass surgery. After the surgery, the blood flow to the coronary artery is increased and the person is relieved from chest pain. And there is also another method that is called heart transplantation. Heart transplantation may also occur in this diagnosis part. Heart transplant is a surgical transplantation procedure which is done to replace a diseased or damaged artery. Replacement of diseased or damaged artery is called as transplantation. This procedure is performed on a patient with end-stage heart failure or severe coronary artery disease. The most common procedure is used to take functioning heart from the brain-dead person and is implanted or transplanted into a person with a damaged heart. இப்போ brain death ஆனவங்களுடைய heart எடுத்து இந்த தேவைப்படுறவங்களுக்கு யூஸ் பண்ணலாம். And last part of this is the cardiopulmonary resuscitation. What is called cardiopulmonary resuscitation? CPR method. CPR is a life-saving procedure that is done at the time of emergency condition, such as when a person's breath or the heartbeat has stopped abruptly in case of drowning, electric shock or heart attack. CPR induces the rescue of breath, which is achieved by mouth-to-mouth breathing to deliver oxygen to the victim's lung by external chest compression, which helps to circulate the blood to the vital organs. This CPR must be performed within 4 to 6 minutes after cessation of breath to prevent brain damage or death. Defibrillation means a brief electric shock is given to the heart to recover the function of the heart, right? So these are some of the different methods of treatment and diagnosis of heart disorders. The first heart transplantation was performed in the human in the year 1959. Human transplant was first performed by Professor Christian Bernard in South Africa in the year 1967, right? So you have to know all this and all. So it's a very important lesson. Please go through all the 1 marks and please read from the first. Each line is very important for your future studies. Okay. If you have any doubt, feel free to ask me. Thank you.